Applied Kinesiology, Session 7. I'm Dr. Gary Dombey, and we are going to be going over the following items in Session 7. 5%er acupuncture using the Shen and Ko cycle, knee dysfunction in the tissues and muscles involved, athletic dysfunction, anaerobic aerobic imbalances, sympathetic parasympathetic imbalances, essential fatty acids and their role in inflammatory pathways, scoliosis, pineal dysfunction, blood pressure, how we approach allergies, and last but certainly not least, the applied kinesiology approach to evaluating emotions and their involvement in the patient's problem. So first, off the bat, we're going to talk about the Shen and Ko cycle and the 5-element scheme of things. So this slide shows how the in the clockwise direction, the circle around the between the elements shows how one element gives rise, nurtures, and helps create the next. And then conversely, how the meridians, the arrows in the middle, represent how the meridians control, limit, destroy, inhibit the other meridians. So it's once again this yin-yang exchange of energy and influences. So for example, wood gives rise to fire, gives rise to earth, gives rise to metal, gives rise to water, which gives rise to wood. That's the creative cycle. Fire destroys metal by melting it. This is how we remember it. Earth destroys water by damming it up and holding it. Water destroys fire by dousing it, of course. And metal cuts wood by, like if you think of a sharp axe, cuts down a tree. And wood destroys earth by growing and splitting earth as the roots grow. So just a quick review, the 85%er. So the 85%er, we start with a strong indicator muscle. I like to use a lower extremity muscle with the patient's spine. We're seated, that way they can use their fingers to pulse point their own wrists, or to therapy localize their own wrists to the pulse points. So strong indicator muscle, TL, the pulse points, you determine which pulse point weakens the indicator muscle, and then you go to an associated muscle related to that meridian. You check for strengthening when TLing that meridian's alarm point, check nutrition on that related muscle, then adjust the associated area on the spine that has the bladder associated points related to that meridian. And then also you want to check the Lovett vertebrae. And then you would tonify using the tonification point for that meridian, and then adjust whatever you might find in that extremity if there's anything that might be involved in interrupting that energy flow. So to go back, just to pick a scenario, say we start with a strong indicator muscle, say it's the quad. Patient TLs their wrists, and you come up with a weakness at the middle left pulse point, which is related to the liver and gallbladder, the wood element pair of meridians. So then you would check the pectoralis major sternal, which is related, of course, to the liver. Or if you think it might be the gallbladder, you would check a popliteus. You might check both and see what you come up with. You can also therapy localize, as I said in session 6, using a superficial and a deep approach, and a lot of times that will differentiate. So once you've determined that, yes, you've got a weak pectoralis major sternal muscle, Then you can check nutrition, liver-related nutrition, to see if it strengthens that muscle or if it negates the therapy localization. Then you would go to the associated point on the spine, which is going to be T910, and challenge and adjust. And then you would go to the Lovett, which would be around T2, and check and see if there's something that needs attention there. Then you would tonify liver 8, which is the tonification point, and adjust the knee if necessary, which we'll be going over in this session. So a lot of times we'll find knee problems, and there will be some kind of liver or gallbladder issue that's maybe part of the problem. Now, the 10%er is where if you have a positive pulse point, you go to the muscle and the muscle's weak, say the pectoralis major sternal is weak, but it doesn't strengthen to liver 14, which is the alarm point. It doesn't strengthen to its own alarm point. So then you back up on the 24-hour clock cycle on the and you look for you go back and you check different alarm points, like you would go to gallbladder next, and then triple warmer, and then pericardium, and then kidney, and then bladder. You're going backwards on the 24-hour clock cycle. And whichever, say you went back 2 and you found it triple warmer, the alarm point for triple warmer, which is CV5, just below the umbilicus, that strengthens the muscle. Well, then you want to bring the energy in that meridian into the gallbladder meridian, the next one downstream. So you would use the low point for the gallbladder meridian to bring the energy from the triple heater into the gallbladder. And then you would check nutrition on the excess meridian, which would be the triple heater. And you would also adjust L1, or you would check and evaluate and adjust at L12, which is the associated point for the bladder. It's bladder 22, which is right at L12. So that's what we call the 10%er. Now, the Shen cycle is displayed here on this slide. The cycle of creation. We can see how you think of it as a clockwise direction. The energy flows clockwise. Fire creates earth, which creates metal, which creates water, which creates wood, which creates fire. That is the creation cycle. The destruction cycle, which is the opposite. Wood, for example, or fire destroys metal, which destroys wood, which destroys earth, which destroys water, which destroys fire. So when there's as there's a need for creation, there's also a need for destruction. So the cycle can go on. So with what we call the 5%er, because the first protocol I taught you was what you'll see about 85% of the time when you test your patients. And then the second scenario, using the 24-hour clock, you'll see about 10% of the time, and you do see it. And then even rarer is the where you find no weak muscle related to the meridian that shows up on the pulse points. So the 5%er, there's positive pulse point, you go to the muscle, no weak muscle. So say, for example, we go back to the liver example. So the middle pulse point tests positive, but neither of the pectoralis major sternal muscles test weak, rhomboids don't test weak, and the popliteus muscles don't test weak, in case it might have been the gallbladder that you were picking up. So then we go forward on the Shen cycle, and we would test a heart-related muscle, subscapularis, and let's say that that muscle tests weak. And so you would, and it strengthens to its own alarm point. Well, then you would treat the heart meridian at the wood point. So here's the heart meridian. You would go over to the wood column, and it would be heart 9. You would treat heart 9. So that's now. Also, if, say, for example, you have a positive middle pulse point, no weak muscle, you go ahead and you don't find any weak muscles, no small intestine, triple warmer, pericardium, or heart, all fire element related muscles, and none of those have weak muscles. Then you would go back to the wood, back to the liver, and go backwards on the co-cycle, which would be taking you to the metal-related meridians, or metal element meridians, large intestine and lung, and you would test, say, for example, a lung-related muscle, say a deltoid, and that muscle tests weak. So then you would treat the command point or element point on the lung meridian for the meridian that you came in on, which would be wood. So you would treat the wood point, which would be large intestine 3 in that particular scenario. So that's all for now. I will be doing a video demonstrating how we do this.